response across the state of South Dakota. We're in a good spot. We do have 58 positive cases in the state. We have negative cases and tests that have reported back of 2,387 with 20 that are pending. 21 people in the state of South Dakota that did contract the virus have fully recovered. Additional counties have been added to the community spread list. You'll find those on the covid.sd.gov website. And frankly, we're really encouraged by our numbers. Thanks for the work that all of you have done across the state to address the virus and the actions that you've taken. It's working. We've been able to prepare. We've been able to stand up commercial labs in the state of South Dakota, which is allowing us to process more tests, and it's giving us better data and facts so that we can continue to build out strategies that will help protect people and families across the state. I mentioned yesterday that we are going to have some conference calls. We did have a conference call with our healthcare providers yesterday. We're working on surge capacity. We know that we will have a peak infection rate in the future, and we are preparing to make sure that our hospital systems can handle that when it comes, and that we'll have the beds available, the equipment available, and the staff available to make sure that we're serving those people that will need health care. We're continually reworking our models. We're taking the information we're gathering from across the country, across the world, and also surrounding states, applying our demographics to it, applying our vulnerable population to it, and how dispersed we are from county to county to it as well, to make sure that it is reliable information for making our decisions going forward. Again, we're continually updating our models, projecting into the future, and making decisions based on the facts that we have here on the ground. I wanted to touch on a phone call that I had last night with the legislators. We're preparing for Veto Day. Again, Veto Day will happen next week. We are having it on schedule, and the Legislative Research Council is planning to conduct it remotely. There will be some legislators that will travel to Pierre. There are many that will stay home. We're encouraging them, if they're not feeling well, to obviously stay there. If they're part of the vulnerable population, to not come to Pierre. There are a few that would choose to come here, and we're allowing that. But we are also asking them to come to make budget decisions and to make sure that they're dealing with some emergency bills that I and my team have put together that will allow us to have a better response to the virus and the state going forward. Every single one of the bills that we are bringing has an emergency clause on it. That means that as soon as they do pass them and I sign them into law, they will be enacted. Typically, a bill doesn't get enacted until July 1st. That is not going to be true for these bills. Because we have an emergency clause on them, they will immediately be put into place and in statute as soon as I sign them. They are all also temporary. They have sunsets on them, so they will expire, and I think that is the right decision that I have made because we are doing this remotely and legislators are voting using technology, that it's important these aren't permanent statutes, that they're temporary to allow us to respond to the virus, and then they will go away. The impact to our state's budget is significant. I'm telling the legislators that I will sign bills that we did for the budget and sign them into law, but I'm not going to spend that money. We're going to probably come back in June and have a special session and make some changes that are very significant to our state budget. Some of these they've already passed. I will sign them into law, but I am choosing as governor to not spend those dollars. I will keep them and hold them, knowing that in June we'll have a better picture of where we're at when it comes to resources as a state to continue to fight the virus and make sure that we're doing due diligence and taking care of people and governing over the people of the state. I want to also focus on the federal legislation. We know that the House just passed the CARES Act, which is a bill that should help us respond and take care of folks through this situation that we find ourselves in. We are still looking at the details of that. There is some language and interpretation and guidance feedback that we will need to give the administration in order for South Dakota to access some of that money. There is dollars that will flow into those caregivers here in South Dakota that will be incredibly important in the future. So we do thank our federal delegation for their work on that bill. There are still some hoops to jump through to make sure that we can utilize all the resources that are available to South Dakota, and we'll get that done. Again, for legislators that are coming to Pierre, we want them to know there will be health screening done at the door. They will all come in one door. They will go through a health screening before they are allowed into the building in order to make sure that we are only allowing folks into the building that are healthy and then allowing them to return home to their communities as well. With that, I will open it up to any questions you may have.
Governor Noem, this is by people who say it's been 8 to 9 days and they still haven't received their test results. One person even said they heard maybe the tests were being sent to California. I was wondering if you could tell me why it might be taking so long and what would say to South Dakotans.
Thank you for that question. Kim Olsen-Reisen with the Department of Health. We do know that providers are using outside labs. The turnaround time for those labs does vary. We've heard up to 5 to 7 days. I would also just update the group and reiterate what we talked about yesterday. The State Public Health Lab is doing testing for high priority groups. If there were specimens submitted for people that are not in the high priority group, those specimens have been returned to the requesting lab for processing. So there could be specimens in that situation.
And it is good for people to know that the labs that go through the State Public Health Lab are turned around in 24 hours. And then by noon every day, those results are uploaded onto the covid.sd.gov website. Other questions?
Governor, this is Stephen from Associated Press.
Yes. Hi, Stephen.
So the State Middle School Association called on you yesterday to close non-essential businesses. Do you have the power to do that? And at what point will you declare a public health emergency?
Well, I have already declared a statewide emergency declaration, which is what we need and covers all the authorities that we need in the state of South Dakota. A public health emergency would be utilized to have the authority to quarantine individual specific situations. So when a lot of people talk about emergency declarations, the one that I have already issued covers all the authorities that they are asking for.
From my understanding, that is a suggestion that businesses should limit gatherings. Do you have the authority as governor to mandate that they either close or enforce that?
Well, I have made the decision to not tell businesses to close in the state of South Dakota. I've been very clear on that businesses should be given the opportunity to serve their customers, to be innovative, to protect their people, and also make sure that they're given the opportunity to have their employees earn a wage and keep food on the table for their families. So that's a decision I've made as governor. My executive order laid that out very clearly. Our emergency declaration statewide gives me all the authorities that I need to continue taking the actions that we're taking as a state, and also gives the flexibility to local communities to do what they think they need to do in their areas. I've been very clear about the fact that I don't think decisions in Sioux Falls are the same decisions that are correct and right for a town like Faith, South Dakota, or Lemon, South Dakota. So that is why we need to be flexible. We need to allow local leaders in those areas to make decisions and go above and beyond my executive order if they would choose. But we will continue forward with the plan that we've laid out.
Do you have any more information about the situation at the women's prison in terms of the concerns there with the spread inside there?
So the situation at the women's prison remains the same as yesterday. We have one positive case there. That individual is resting and actually doing very, very well. And we have had no additional positive cases associated with the women's prison.
Governor Mike Banner at KWAT Radio.
Yes, Mike, go ahead.
We began the week, Governor, Monday with 28 positive cases, and now today the number is at 58, 30 over the course of the work week here. As you look at it kind of from a 30,000-foot view, how would you characterize how South Dakotans are complying with the regulations that you're requesting, and how the virus numbers are tracking in terms of, I guess, best case scenarios of how you would like to maybe see them?
Well, I think what we are doing is working. I'll be honest with you, Mike. You know, I anticipated we'd have a lot more people that would test positive for COVID-19 at this point if you would have asked me a few weeks ago. So I think that what we're doing is working. We need to be steadfast and remain on this pathway that makes sure that we're slowing down the spread across the state of South Dakota. I've been telling folks for weeks that we will continue to see more and more infections, and there will be times where we will not be able to continue to give you the kind of test results that we have been because there will be so many in the state of South Dakota. I stood here quite some time ago now and told you that up to 30% of our population could contract the virus, and we need to be prepared for that. The fact that we are now today where we are, I think, is good news. We are working hard to take care of those folks that are testing positive and making sure that we're still practicing social distancing. I want to continue to remind people that we are not on this plan for just a week, that we will be doing this for many weeks ahead. We do not anticipate that we will see peak infection rates until probably the end of May, early June. So whatever we are doing, we need to sustain, and we need to be steadfast. We need to be consistent and committed to doing the right thing and making the right decisions day after day after day. So I think the folks of South Dakota should be encouraged that we still have a good handle on where we're at, that people are getting health care that they need, that we have people that are recovering every single day too, and that we're going to continue to look at all the facts that we have every single day and reevaluate and make decisions that are best for the people of South Dakota.
And a quick follow-up, Governor, if I may, and I think you probably addressed this to a certain extent in your earlier comments, but the letter that was sent to you from the South Dakota Medical Association saying you're not doing enough to stop the spread, I'm just giving you an opportunity to, I guess, comment on that. Is there more that you can do? Is there more that you're contemplating doing?
Well, we already have a statewide emergency declaration that's in place. I did that quite some time ago. These declarations and public health declarations look very different from state to state. So I'm not sure if the doctors don't realize the difference between what I've already done and what they think they need me to do. In our state, in South Dakota, if we have a public health emergency, that gives us the authority to deal with individuals that may need to be quarantined, that are not taking due diligence to protect their people and their communities. It gives us the authority to go forward and to deal with specific situations. But the statewide emergency declaration that I've already done covers exactly what I believe the Medical Association thinks that a public health emergency would do. And I just want to be clear that many times these declarations have different components to them from state to state. And looking at my state, my statutes, my constitution, that statewide emergency declaration was exactly what we needed to have in place.
Hi, this is Morgan from the Rapid City Journal. Regarding the 2 new cases in Pennington County today, are they related to Monument Health in any way or to the caregiver there who came into contact with 112 people, including patients? And were they travel related or both related to community spread?
I can't get into the details of them specifically. I can tell you that at least one of those was acquired within the community, and that's why you see community spread being listed for Pennington County at this time.
And as you know, and we've talked about at previous press conferences and answered questions before, is that the Department of Health is doing investigations with each of those individuals, collecting more information, talking to them. Everyone who has been exposed to someone who's tested positive is getting daily contact with our team and the Department of Health and following up and making sure that they're still feeling well going forward. So, later on there will probably be more details available, but at this point in time the investigations are still going on with those positive tests.
Yes, Governor, this is Gail Van Gendon with the South Dakota Mail newspaper. Schools have been struggling in making decisions right now regarding staffing of hourly workers during this closure. And at this time, do you anticipate an extended school year? And who will be making that ultimate decision?
Well, we will be bringing forward a couple of bills that will deal with education and giving some waivers to our school districts to give them flexibility in assessments and then also the minimum instructional hours. One of the bills will be giving the Secretary of Education the authority to determine instructional hours that will be required and giving us more flexibility for what these school districts will be dealing with. The one thing I would tell the public and I would tell our school districts, because we've had many conversations with them, is how much we appreciate the work they are doing, even during this entire situation. They're feeding our kids remotely. They're putting extra work into instructional methods that are distance learning, putting together packets, finding out ways to deliver them to kids at home. And I think the work that they've done is phenomenal. Also, we have not changed our school district's budgets, and we don't expect their revenue to change from what they had previous to this virus hitting the state of South Dakota. So The money that they had for those hourly workers, we've encouraged them to use to continue to pay those hourly workers and to use in ways to serve their community during this time. So we're giving them as much consistency as we possibly can. I know they're going above and beyond each and every day, and I think we're incredibly grateful for their efforts.
Thank you.
Governor, this is Trevor Mitchell with the Artist Leader. We've heard that during a call recently with lawmakers, there was a discussion about the state potentially having some issues with gloves and gowns. How is the state doing on personal protective equipment?
This is Kim Alston-Risden. An update from late yesterday is we did get our second allocation from the national stockpile. That is helping in particular with some gown issues and face shields, which currently are in short supply. But all in all, we're able to keep up with the requests that we've received in a very timely way. We will continue to work with our private suppliers. We also do have requests pending with FEMA headquarters, in particular for gowns and face shields. And so we're hopeful that we will get some relief from them.
Other questions?
Have you been given any sort of, by your team or a dollar figure as to what you can expect from the federal government stimulus package, or?
No, not necessarily. Obviously, the Department of Health has already received some dollars to utilize in the first bill that they passed, and so we are working to get that and plug in so that we can utilize it for resources right now. We're waiting for guidance, which is what they need to do after they pass legislation, is give us guidance on how those dollars will be allocated, where they will be funneled through, if they're going through hospitals, if they're going through clinics, if they're coming through the state government. We know there will be opportunities for us to have some funding sources met, but some of the language in the bill has tied our hands, and so we're working with Treasury to see if we could get some flexibility on getting some of those dollars to South Dakota that we know was intentioned in the legislation. It's just that the way that it was allocated was difficult for us to actually utilize it. So we do believe that we'll get a resolution on that and have more to go as the guidance comes out.
In terms of numbers of hospital beds in South Dakota.
I know this has been talked about before, but
We got a question in the room, and then we'll take the one that's on the call.
Sorry about that.
That's okay.
In terms of hospital beds in South Dakota, and how many do we have total, and how many have been freed up as a result of the not doing elective surgeries? And we'll just start with that. And I'll go for a question.
Okay. Hospital bed and hospital bed use is something that we monitor on a daily basis. The answer to that question really kind of depends on what type of beds, so they're obviously classified in different ways. We have approximately 2,300 beds available in the state. We are working with hospitals right now to identify how they can increase those numbers and create surge capacity. And what they will need in terms of staffing and equipment to do that. So that's some of the active planning that the governor's mentioned that's happening right now. So actively looking at that, and especially what kind of equipment needs folks might have to be able to deal with COVID into the future.
And just to follow up quickly, Governor, what do you have planned with the National Guard in terms of temporary facilities and assistance?
Well, our National Guard has been involved in the planning for this situation for months. We have a member of the National Guard in our Emergency Operations Center that is there being a part of the planning. We also have brought in more resources from the National Guard to help us with logistics and planning on standing up hospitals and other facilities that we may need to care for people into the future. Obviously, our National Guard individuals are extremely talented and gifted. We have medical personnel, medics, nurses that are all a part of our National Guard. We're also very cognizant of the fact that they are more than likely serving in their communities as well. So we don't want to pull that expertise out of a local community if it's needed there. But we are evaluating all of that, and our Adjutant General Marlette has been outstanding in planning purposes, giving us the time frame, how quickly they can turn facilities into hospitals, and laying out that logistical planning that's incredibly important for us as we plan for the future. So every asset that the National Guard has available has been a part of the analysis of what we can do and how quickly we can do it, and they will be there when we need them. They are ready and waiting.
I'll follow up on the hospital bed capacity, 2,300. Data science suggests that you're going to need those 2,300 or maybe more.
I think part of the answer to that question is how well we're able to blunt the peak of COVID cases, and that's exactly what we're trying to do in the state, as the governor's explained several different times. And so the answer to the question of how many hospital beds we will need depends on how well we can minimize the spread of this, how well we can keep cases down so that we can manage within the beds that we have.
I mean, it would be safe to say we're going to need all the capacity that we have in South Dakota today. We will be adding capacity as well, preparing so that we do have the ability to take care of every individual who might need it. We are not in our analysis looking at best case scenario. We are looking and preparing for what may come our direction. Any questions on the phone, on the call?
Yes. Question for you in reference to tribal. Are you guys getting reports in from tribal health as far as COVID-19 testing at there, and then is that being posted as well on the site, or how is that being handled?
So the requirement is that any positive tests for any South Dakota resident, regardless of where that test is processed, be reported to the State Department of Health. We do have a standing weekly call with tribal leaders. We just had that this morning and had great dialogue about what they're seeing in their communities. Of course, we have tribal members that might interact with different states, and so it was great to learn how they are getting information from other states as well. I would characterize the call this morning as being very complimentary of the information that tribes are able to access around the information that we've made available. We also do have a call with James Driving Hawk, who is the leader of the Indian Health Service in our region this afternoon, to make sure that we're connected with that system, providing them supplies as needed, and ensuring that any reporting that needs to happen is happening.
Any more questions on the phone?
Governor, with the amount of testing that you've done, it looks like about 2% of the tests are resulting in positive for COVID-19. Are there flu-like symptoms or other illnesses that are going around that are causing people to have symptoms that they suspect are COVID-19 but might be something else?
This is Kim Olsen-Rice, and that's a great question. The symptoms of COVID-19 are very similar to a lot of other things that people might be experiencing. We're getting into seasonal allergy season, so folks might be having upper respiratory symptoms due to that. We know influenza is still circulating, and so people might have symptoms of influenza A or B. We're seeing both types of that in our state, and then just common cold, which is a form of coronavirus. It's not COVID-19, but certainly common cold symptoms can be confused for COVID symptoms as well.
Okay, one more question. Anybody? Okay, thank you so much. We'll visit with you again soon.
And you have been watching a KELOLAND News special report with the Governor of South Dakota, Noem, as well as the Secretary of Health, Kim Malsom-Risden. Now, Kim Malsom-Risden confirmed that the state does have a shortage of personal protective equipment for healthcare workers and has just received a second allocation from the national stockpile of things like gowns and face masks. Sounds like we still need more of that type of equipment. We were also told by Governor Noem that that they are working with the state's health systems to expand capacity to treat patients. That right now there is not a surge in capacity, but that they are preparing for that. We do know there are 58 positive cases, 2,300 cases came back negative, and 21 people have recovered from COVID-19. The governor also talked about holding Veto Day next week at the Capitol. She said some state legislators will stay home while others will return to the Capitol to take part in Veto Day. She said those entering the Capitol will be screened. They will have health screenings and not be allowed in if they're not feeling well. She also said she expects to hold a special session, a special legislative session in June to deal with the crisis in the state and to deal with the budget and changes to the budget, as well as emergency bills to help deal with everything. I think they're also going to be dealing with emergency bills on Veto Day. We